Now, anything that has interventions in it is going to pay more money. It is going to be more competitive. In general, the medical side will have a better chance. So I would say these are the two main things I want to mention, that people understand these things and not mess up their career. 800,000, like 8 lakh, 10 lakh dollars,
Oh,
800,000
that,
to a million.
hello all, this is Dr. Dheeraj Masapu, and today we have Dr. Rajiv Iyer, who is working as Associate Professor of Anesthesiology in the University of Pennsylvania in USA, and he has done his residency in PGH Chandigarh in India. Later on, he pursued his fellowship in University of Toronto, Canada. After that, he moved to USA. Welcome to the channel, Dr. Rajiv.
Thank you. It's a pleasure to be here.
So not only that, you help a lot of doctors across the globe to settle in USA and Canada and other countries. Particularly,
Mhm.
USA is the area where very many people are actually taking your help through your website called IMG Secrets. So thank you for all the help, and we want you to tell my subscribers what is the pathway after doing post graduation in India to settle in USA. So what are the different important things that a postgraduate should know from first year only. If he knows all these things, then he can plan in a better way, is what I feel. You can
Sure,
just take over.
absolutely. Absolutely, absolutely. So I'm going to keep this common across all specialties because I know you're an expert yourself and you have people from all specialties. So first of all, there is a disclaimer I want to make, and this speech is on behalf of IMG Secrets and is not affiliated with University of Pennsylvania. So I do want to make that clear because University of Pennsylvania has asked me to say this. All right. Now, for anyone, there are basically three pathways to get established as a doctor, as a fully licensed doctor in the USA. And this is for all specialties. So, number one is residency or PG. Now, this is what we call as the traditional pathway. Number two is a fellowship. So, usually this is a clinical fellowship. This is equivalent to what you call as a DM, MCH, or a fellow in India. The third option is directly coming in as an attending. Now, this is equal to a consultant position, and in the USA, Canada, this is referred to as an attending physician. So, the way you want to think about it is if you are a fresh PG, if you're a fresh graduate who has completed your MBBS, or you're a fresh PG who does not have much of experience on your CV, the most common pathway would be residency. So, meaning you have to complete all the requirements like USMLE steps, and then you apply through a website called NRMP, and then you follow the process. There is a fixed timeline on when to apply, how to move forward, and things like that. Now, for this, the expectation is that you need to have a really decent mid CV, a personal statement, and things like that. Now, the second category are those who have actually done their PG and now have a few years of experience, usually 3 years, 5 years in a particular subspecialty. Now, for example, let's say the example of anesthesia. Now, this person has done PG in anesthesia plus has, like, let's say, experience in neuroanesthesia. They could have done a fellowship or they would have worked in a neuroanesthesia specialty for the last many years. So they have an established track record of saying, okay, I'm now focused on a particular specialty. And this can be across any specialty. Now, if you're an ENT, you can say it's rhinology, skull base surgery, so on and so forth. And these are the folks who can now apply for a clinical fellowship. Now, for majority of you, I would say for almost all of you, for clinical fellowships, you do need USMLE exams. So this is a basic requirement. Now, there are exceptions, but for majority of you, you do need USMLE exams. Let's say there is a third category of people who actually have experience of more than 10 years. And these are the folks who are really well known in India. They have produced a lot of publications. They're working in reputed hospitals. Now, these are the folks who can actually directly transition into a consultant position in the USA. Now, this is a special category. For majority of you, you do need USMLA, but these are the folks who are more likely to be successful in finding positions even without USMLA. So that is the way you all want to think about how to transition yourself into the USA based on your experience.
Got it. So, for example, we'll take a scenario of a person with around 5 years experience, and then he has done few publications, and that's all he has. No niche specialty training or anything. It generally worked everywhere. So, how can he? What are the chances of he getting it?
So for someone like that, I think he or she can focus on applying for a clinical fellowship. In my opinion, for people who are trained in India, a clinical fellowship is a fantastic step to transition to USA or Canada. So the way you want to think about it is, let's say you worked 5 years across all specialties. In that case, you want to pick something that is less competitive. And obviously, how would you know this? This is something difficult for you if you're not familiar with the system. I mean, we can help with these things, but you want to pick some specialty that is not really well known. So, for example, there are things like clinical anesthesia in anesthesia, and things that are not very enticing. So, those are some of the specialties that I would say are less competitive. So, you want to focus on those things. And when you're submitting an application, you want to make sure you do have some experience in that particular field. Now, for example, you're a radiologist, you do all kinds of radiology, and which is very common in India.
Yeah.
But the way you want to think about it is most of the clinical fellowships in radiology are in MRI. It is not ultrasound, it is not CT scan. It is not nuclear medicine, which is a completely separate specialty. It is all in MRIs. So the way you want to think is, okay, what is my MRI experience and what is that thing where there is a likelihood of getting? So that's the way you want to think about it.
So you're saying that better to go with specialties where many people wouldn't enter. So that is the path to enter,
Right. So
or
many
less
people,
demand, least
sorry,
demand
go ahead.
ones. The specialties which are not in that demand is what we have to select.
Right, right. So most of the specialties are in demand, but there are some that are less likely for local graduates to apply. Now, local graduates, so the common way to think about it is whichever specialty pays more money, that is going to be highly competitive.
Hmm.
Now, anything that has interventions in it is going to pay more money, it is going to be more competitive.
Got it.
So ideally, it's better to stay away from anything that's based on interventions. Like it could be
Hmm.
interventional pulmonology, interventional cardiology, interventional radiology, any such things that is based on interventions. So, and that is one way of thinking about it. Did I answer that
Got it.
question properly?
Yes, yes. So I understood. Basically, wherever there is intervention, there is money, demand is more. Better to stay in areas like perioperative medicine, if for anesthetists, or better to be on something like uh, infertility or something in gynecology. Or infertility is again high demand area, I think.
Right, right. In gynecology, we have seen people apply for things like vulvovaginal health
Hmm.
and things like so something which is a combination of clinical and research positions, and
So
those are the type of things that are not
I see.
very
So
enticing.
every specialty will have certain less demanded areas, basically. That is what
Right,
you can help. Yes.
right. Every specialty will have it, and also there is a concept of what is called as accredited and non-accredited fellowships.
Hmm.
In general, the accredited fellowships are difficult to get. So you can all focus on what is called as a non-accredited fellowships. But from your
Got it.
standpoint, it doesn't make a difference. So you can focus on either of those. But in general, there is a high likelihood of people matching into non-accredited fellowships than accredited fellowships. Again, there are exceptions, but this is
Right.
in general.
Okay. It's very complicated. Yeah, non-aggregate. So basically, we are looking at an entry into the system. So better
Correct.
to go into less demanded ones, non-accredited ones, so that we get into the system. Correct, no?
Correct. Correct.
Yeah.
So,
Okay.
if you think of the entry point alone, the best
Hmm.
way to enter the system is through clinical fellowship. Now,
Hmm.
once someone gets into a clinical fellowships, two things can happen. They
Hmm.
can use this experience and directly become a consultant,
Hmm.
which is what we refer to as the alternate entry path. So basically,
Hmm.
you bypass your PG training or residency completely in the USA, and
Mm.
then you directly become part of the system through clinical fellowships, which is what is more likely to happen for people from India.
Got it.
Now, if a candidate is unable to secure that attending job directly, then they can
Mm.
always use that clinical fellowship experience and go back to PG. Because getting a PG is also extremely difficult. But if someone has a clinical fellowship experience, then the chances of them getting a PG goes up. So this is like the
Understood.
uh,
So it's more like their American board trained fellowship there. And then you,
so so here's the thing. The board training is a completely or board certification is a completely different concept.
okay,
So we are not even getting there. So
okay.
clinical fellowship is something like a super specialization that is done in these countries after
Mm.
your PG. Now, if a person is coming from India or any other country for that matter
Mm.
and does a fellowship alone, they just get that 1 year or 2 years of 3 years of clinical experience. They do not become certified in the USA.
Mm.
This is just a clinical experience alone. But the beauty of this is, with all the new state regulations that's coming up, with the shortage of doctors that is going on, and the availability of alternate entry path options, that candidate is now at a stage or phase of their career where they can actually apply to become directly a consultant through the alternate entry path. And then comes the concept of being board certified and all that stuff.
Okay,
Yeah.
okay.
So board certification essentially means that in India, you finish your PG, you write your exams, you become certified in that specialty. So in the US, the same thing happens. You finish your PG, you write your exams, and that concept of being certified is called board certification.
So now, for example, we chose a specialty which is least demanded. We did a fellowship. Next, what after that?
So as you're doing your fellowship, this is when you would look for a job as a consultant, ideally.
Mm.
Now, let's say you get into a fellowship in neuroradiology.
Mm.
Now, during your initial few months,